Hello ladies, and thanks for joining us again on our Impact Your Life channel. And we are on episode 16 this week in our pregnancy and postpartum series. And we're going to be talking about hand and wrist pain and swelling today. I am Christie Amundson. I'm a physical therapist and I am 35 weeks pregnant this week. And as a PT, I am trained to treat the entire body. However, here at Impact, we actually have a therapist who specializes in elbow, wrist, and hand treatment, and she is who happens to be my special guest today. So we're going to have Jocelyn Bruce join us. She is an occupational therapist who's been treating elbow, wrist, and hand issues in the general population as well as in pregnant and postpartum patients for over 26 years.
Hello everybody, my name's Jocelyn Bruce.
And first we're going to talk about swelling. So we went into some detail with swelling on our episode 9 where we were talking about foot pain and swelling and cramping. So if you want more details about why you get more swelling in pregnancy and postpartum period, please refer to that video in episode 9. But generally speaking, the amount of swelling that we get during pregnancy has to do with the increased fluid volume in our bodies that we get to accommodate the growing baby and to accommodate the mom to support the growing baby. So what's considered normal with swelling? Well, number one, if you are in a warmer climate, or if you're seasonally go through the summer or have a really hot or humid day, it's normal to have some swelling kind of generally, an increase during those climates. It's also normal to have increased amount of swelling if you have a diet that is high in caffeine or high in sodium. So that could mean that just on a certain day you have a really high sodium meal or drink a little bit more caffeine than usual in that particular day, that you may see more swelling during that particular day. And it also could mean that if in general your diet in general is higher in sodium or caffeine, that you may need to address that you have kind of generalized increase in swelling. What is not normal are signs of preeclampsia. And those are if you get swelling in your face or your eyes, if you're getting persistent headache along with swelling, if you have vision changes along with your swelling, abdominal pain, or a sudden very drastic weight gain. Also, it happens to include an increase in blood pressure. So if you have the ability to take your own blood pressure at home or at a pharmacy near you, your blood pressure would be much higher than normal in preeclampsia. The other sign of what's kind of not normal in terms of swelling would be we'd be concerned about a blood clot. We did talk about that in episode 9. That's much more common in the lower legs than it is in the arms, although it does happen. It's
on a
rare
occasion. Yep.
So if you're looking for signs for that, please refer to episode 9. But if you ever have any questions about whether your swelling is normal or not, please call your provider, medical provider that's monitoring your pregnancy or you during the postpartum period, and to find out whether or not what you're feeling is considered normal versus abnormal. And the next question is, what do we do about it, right? Mm-hmm. So we talked a lot about this in episode 9 as well, but if you are in a warmer climate or if it's a particularly hot or humid day, you want to try to limit your time in the heat to avoid some of that swelling. Mm-hmm. You want to drink plenty of water. Sounds a little oxymoronic, but usually if your body doesn't have enough water, it tends to retain water, so it kind of holds on to that fluid more, versus if you're drinking plenty of water, it kind of gives your body permission to let go of some of that fluid. You can generally decrease your salt or caffeine intake, and the other thing is in your diet, you can also increase your potassium intake, which is more like bananas, avocados, baked potato. The skin of a baked potato has a lot of potassium in it, actually a lot more than a banana does. And then you also want to avoid wearing tight things on your wrist, like bracelets, watches, or rings. So wedding rings or any other kind of rings, sometimes you end up having to forego that, especially in the later trimesters in pregnancy. You also can do ice and Alleviate. Obviously, we talked a lot about that for the feet. However, you can do that for the hands as well. Remember, if you are doing ice, you can wrap an ice pack, put a towel around it first, wrap an ice pack around your hand, especially where you're having the most swelling. And then try to elevate it above your heart. And that means not just your hand above your heart, but your entire arm. So where we want the swelling to kind of run downhill, or all the fluid to be able to run downhill kind of to your armpit, which is where a lot of it gets reabsorbed. And then I know we talked about in our episode 9 about compression stockings for the feet. They do have that option for the hand as well, correct?
They do. I brought one to show you. This is a compression glove. This is for the right hand. And I just wanted to show it to you and then have Christine try it on. You'll see the seam here. Let me show, there's a seam right there. That should be on the outside. If this were inside out, that seam would push against the skin and leave a red mark and an indentation, and we don't want that. So this actually goes on the outside, the seam. So this is a right hand glove. I'll have you just start to put it on, and what you're going to do is just crinkle it up halfway and start to get all 5 fingers in place before you pull it down. And you could wear this about 8 to 12 hours a day maximum, whether you wear it at night only or if you wear it during the day. It's however works for you. But 8 to 12 hours a day, and this gives you a little compression. It's not horribly tight, but it gives you a little compression to help pull the swelling out of there, and it's more comfortable.
But it should feel relatively tight, right?
Snug. It should feel
maybe
snug.
This is probably too
This
big
one
of a
is too
glove
loose
me.
for you. Yes, yes.
And
so it should feel snug.
We'll give you some options about where to maybe get this or where to start looking. In the comments below, we'll link. Jocelyn will give us the information on where you can find these and order them online and appropriately size yourself.
Exactly. And they're not horribly expensive, which is the nice thing.
Very good. All right, so we're going to move on to pain in the wrist and hand during pregnancy and postpartum. All right, so now we're going to talk about pain in the wrist and hand. So Jocelyn, what do you see are the most common issues in the pregnancy and postpartum populations in terms of the wrist and hand?
There are 2 main things that I see mostly. Carpal tunnel syndrome, which is very common and pretty well known in pregnancy, but also not in pregnancy. And then something else called Quervain, which affects more of the thumb and wrist side of the hand, also seen in pregnancy and post-pregnancy, but also in the general non-pregnant population as well. But basically in pregnant women and postpartum women, carpal tunnel and Quervain are the main issues.
Okay. So let's start. Where do you want to start?
Let's talk about carpal tunnel first.
Okay.
Carpal tunnel is presented typically with pain in this part of the thumb, in the wrist. It can present with some weakness. Sometimes people drop things because they lose that pinch. Many times there's numbness in these first 3 fingers. So it's quite debilitating, and it's difficult to sleep. It causes a lot of pain. It's very alarming. So there are ways to handle that during pregnancy. One thing is wearing a brace. This is just a basic wrist brace. You'll see it's got a little bend there, so it brings the wrist back. This is something that can be worn at night or during the day, or both, depending on what you need. I always say wear it 8 to 12 hours a day at least, and if you are really in acute pain, having a lot of pain or issues, certainly you can wear it longer for the temporary time of pregnancy. When a person's not pregnant, I don't want somebody wearing it 24 hours a day, but during pregnancy, we just have to get you through that painful time. So yes, this is a Velcro closure. This is just one sample, and you can see the thumb is open here, but you can also see that it bends the wrist backward. What that does is it takes pressure off of this area of the wrist. This is what's happening in carpal tunnel. There's a lot of inflammation there, and it puts pressure on the nerve and the tendons that go through there. That's what causes all the problem. So this helps relieve the pressure. And then there are also some stretches that can be done as well. I'd be happy to show you those.
Awesome. And I would assume, I know at night a lot of times, myself included, we like to curl our hands kind of up underneath the pillow or down, and that probably this would help us to avoid that.
Exactly. It helps keep that whole wrist channel open and helps alleviate the tension through the whole forearm.
Awesome.
Yeah, so nice, simple fix.
Very good. So we will link a your favorite brace for
Right,
this.
I do have a favorite one. Again, it's not horribly expensive, and it's very supportive. I do like it a lot.
Awesome. So we will link that in the comments below for any of you interested in trying this out.
Now I have some general stretches to show you if you'd like to know the stretches for carpal
absolutely.
tunnel. All right, so basic one is just coming up on your elbow and just doing some gentle wrist motion, bending forward and back just to stretch that wrist. Pretty common, pretty easy. You can do it anytime, anywhere. Just doing several repetitions is fine. Then how about a circle? That's it. So just general motion like that, first of all. Next, make a fist, and then just stretch those fingers out as far as you can. You'll feel a nice stretch through that whole palm. You don't have to squeeze tightly, just a gentle fist and open. That's it. Good. Now let me show you some stretches, some exercises for the tendons that run through this wrist channel that get compressed with carpal tunnel. So this is your starting position.
Okay.
Then you're going to do what's called a tabletop. This looks like the top of a table. And then you're going to do this. It's like a C. We call it a straight fist. So those end knuckles are straight. Yep. And then do a full fist. There you go. And now the tricky one, bring it up into a claw so that's straight and these last ones are bent. Very good. So you'll do that repeatedly. Tabletop, straight fist, full fist, claw. Good. And you'll feel that pulling through there, I bet, don't you? Good. And you'll do all of these that I've just mentioned, the wrist motion, the wrist circle, and these tendon glides. Every hour, just do 5, 6, 7, up to 10 repetitions, just to keep yourself limber. I don't like to have people do it, hundreds of times during the day, but just to keep yourself limber. Now there's another one I'd really like to show you. If you can comfortably get your hand flat, we're going to work on individually moving a finger. So hold your other 3 fingers down, and you're going to bend that finger toward your wrist and out. And you'll feel that all through here, can't you? And you'll do, again, 3 or 4 repetitions and then switch fingers. This one always is a little tight. How's that feel?
Good.
Yeah. And then, of course, you'll just do all the fingers all the way up and as far out as you can go. And the pinky. Good. So after doing between 3 to 10, whatever's comfortable, number of repetitions, you feel fatigue in there.
Yeah. I'm surprised I do. But yes,
I know, just those few repetitions. And then there's one more for carpal
Okay.
tunnel. We are going to do what's called blocking, meaning you're going to block the movement of one joint so you can focus on the next joint. So let's start with the pinky. That's sometimes the easiest. You're going to hold on to the large knuckle so it does not move, and you're going to bend the middle knuckle down. That's it. So same thing, you'll do just multiple repetitions on each knuckle.
So you don't want this to bend.
Correct. You're blocking that large knuckle. And then, of course, you'll go right down the row, do each finger. Just like that. Again, several repetitions, whatever you're comfortable with, just to keep that flexibility. And it's a little awkward. You might have to change your hand position, of course. Yeah. So you've just done the first set of knuckles. Now we have to do the tip too. So same thing. You're going to block the middle knuckle so you get movement just at the very end knuckle.
Got it.
So you'll do that with each finger, including the thumb. You don't want to forget the thumb. So with these exercises, you're working the muscles of the wrist and hand, you're working the tendons of the wrist and hand, and then we're making sure that we're keeping compression off that nerve, which causes that numbness and tingling in the fingers. That is helpful with the brace that we talked about.
Awesome.
Yeah.
And those are actually kind of easy, so you could do them sitting at your desk at work or whatever.
Absolutely. If you're a passenger in a car, you can do it. I mean, yeah, they're easy to do.
Awesome. Well, thank you.
You're welcome.
And then we'll move on to the next diagnosis that you see.
Yes. Hello again. The next issue we wanted to talk about is called Quervain's. It is, as I mentioned earlier, fairly common in pregnancy, but also in folks who are not pregnant too. It causes a lot of pain in the thumb and on the thumb side of the wrist. It can be very debilitating. What happens is the tendon, some of the tendons that control the thumb motion, moving it away from the palm, get inflamed. And so every time you move your thumb, every time you move your wrist in combination with the thumb, you can get this significant pain along here. The way we handle that is ice, again, and rest and elevation, just as you've mentioned before, but also another brace. This style of brace is one of my favorite style of braces just because it's so supportive for the thumb and the wrist. This is similar to the one I showed you before, but you'll see this thumb extension. This is called a thumb spica brace, S-P-I-C-A brace. And this is just a Velcro closure again. This is a right-handed one. And this may not be your size, but I thought you could demonstrate it. And the thumb is supported here. There is a little metal bracket at the wrist, so the wrist is not allowed to move. And then there's a little bracket at the thumb, so the thumb is held out to the side a bit like this. And yes, you can Velcro close it. Yeah, it's not the right size for you. But the idea of this is just like before, to be worn 8 to 12 hours a day at minimum. If you're having a very difficult time and pain, then you could wear it more during the day during pregnancy. When you're not pregnant, I only recommend 8 to 12 hours maximum a day. We want to give this tendon relief, the tendon that controls the thumb. We want it to be stabilized and not move, as well as supporting the wrist. So you can feel how sturdy that is.
Yeah,
right?
for sure.
Yeah.
It feels similarly to the other one from the wrist standpoint, but it really immobilizes the thumb.
Exactly. Now this is too big for you. If it fit well, your thumb, the very tip of your thumb could still bend like this. So you could still pick up items, even sign your name. And it's intended to allow that very distal tip of the thumb to move. So this is not the correct size, but we will add a link with my favorite type of thumb spica so you can see how the sizing is, and you can get one appropriate to fit you. So the splinting, the brace is very important with Quervain's. And then there are just simple exercises similar to what we've done before. We just need to keep the mobility of the wrist, basically, with Quervain's. Because when you're wearing this brace for up to 12 hours a day, you're going to get stiff and possibly weak. So we have to keep that mobility. So same kind of thing, up on the elbow. You're just simply going to do those same wrist bends and extensions just to keep that mobility. And then because your wrist is so active, exactly, yep, just that circumduction, that circular motion, that's it. So with Quervain's, it's resting the thumb. That's the most important thing, resting the thumb and keeping the wrist mobile.
And as we've talked a lot about already in previous episodes, a lot of these things, although they do happen generally quite often in the general public, but when pregnancy certainly contributed to the fact that we have our increased laxity in our bodies because of the relaxin hormone that we've talked a lot about already, and that kind of can wreak havoc on the finger ligaments and wrist ligaments, which can further contribute to more instability and more inflammation in those areas, correct?
Right, and the increased volume, fluid volume, adds that extra pressure through the channels of where those tendons and nerves flow in the small area of the wrist and thumb. So that certainly adds to it with pregnancy. And like you said, even postpartum, the hormonal changes cause the laxity of ligaments. So it can continue, unfortunately, even after pregnancy for a while.
Well, and then you have your lifting and carrying an infant around all the time.
Absolutely, absolutely, yes.
So it's even more
Yeah.
demand.
Mm-hmm.
All right, so thank you so much for all this, Jocelyn. This has been
welcome.
very helpful and informative. And we hope you learned something too. If you did, please give us a thumbs up and subscribe to our channel and hit the bell icon for notifications for future episodes. And we will see you next week. Take care.